Rezlidhia is a prescription medicine used to treat adults with acute myeloid leukemia with a specific gene mutation. Generic name olutasidenib. Olutasidenib works by stopping or slowing the growth of cancer cells. How to use. The recommended dosage of Rezlidhia is 150 mg taken orally twice daily until disease progression or unacceptable toxicity. Administer Rezlidhia capsules orally about the same time each day. Do not administer two doses within 8 hours. Take on an empty stomach at least 1 hour before or 2 hours after a meal. For patients without disease progression or unacceptable toxicity, treat for a minimum of 6 months to allow time for clinical response. Swallow Rezlidhia capsules whole, do not break, open, or chew the capsules. If a dose of Rezlidhia is vomited, do not administer a replacement dose. Wait until the next scheduled dose is due. If a dose of Rezlidhia is missed or not taken at the usual time, administer the dose as soon as possible and at least 8 hours prior to the next scheduled dose. Return to the normal schedule the following day. Contraindications. Before you start treatment, tell a healthcare provider about all the medical conditions, including if you have liver problems, are pregnant or plan to become pregnant. Rezlidhia may harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Rezlidhia passes into your breast milk. Do not breastfeed during your treatment and for 2 weeks after your last dose. Precautions. This drug may make you dizzy. Do not drive, use machinery, or do anything that needs alertness until you can do it safely. Limit alcoholic beverages. Before taking olutasidenib, tell doctor pharmacist if you are allergic to it or if you have any other allergies. This product may contain inactive ingredients which can cause allergic reactions or other problems. Talk to a pharmacist for more details. Before taking this medication, tell doctor pharmacist your medical history, especially of liver problems. What are the side effects of Rezlidhia? Rezlidhia may cause serious side effects, including hives, difficulty breathing, swelling of the face, lips, tongue, or throat, dark colored urine, loss of appetite, stomach pain upper right side, tiredness, weakness, and yellowing of your skin or eyes, jaundice.